Hey everybody, welcome to Journey to Vitality. In today's video, we delve into effective natural solutions that could finally silence those nightly disturbances. Did you know that there are natural remedies that could finally put an end to your snoring? If you've been struggling to get a quiet night's sleep, these solutions might just be what you need. Today, explore effective ways to tackle snoring without resorting to invasive measures. Understanding snoring. Snoring is a common sleep disorder characterized by noisy breathing during sleep. It occurs when airflow through the nose and mouth is obstructed, leading to the characteristic sound of snoring. According to the American Academy of Sleep Medicine, snoring affects approximately 45% of adults occasionally and 25% habitually. While occasional snoring may not be a significant concern, chronic snoring can disrupt sleep patterns and indicate underlying health issues such as sleep apnea. Several factors contribute to snoring, including anatomical predispositions such as narrow airways or enlarged tonsils, which can restrict airflow during sleep. Nasal congestion due to allergies or sinus infections can also contribute to snoring by obstructing nasal passages and forcing breathing through the mouth. Lifestyle factors such as obesity, smoking, and alcohol consumption can increase the risk of snoring by relaxing throat muscles and narrowing the airway. Snoring is categorized into different types based on its sound and origin. Nasal snoring is typically caused by congestion or nasal obstruction, forcing individuals to breathe through their mouths during sleep. Mouth breathing can lead to the vibration of soft tissues in the throat, resulting in throat snoring. Tongue-based snoring occurs when the base of the tongue relaxes and falls backward into the airway, obstructing airflow. Understanding the type of snoring can help determine appropriate treatment options to address the underlying cause and reduce symptoms effectively. Lifestyle modifications. Maintaining a healthy weight is crucial in managing and reducing snoring. Excess weight, especially around the neck and throat area, can contribute to airway obstruction during sleep, leading to snoring. Research published in the journal Sleep indicates that obesity is strongly associated with snoring and obstructive sleep apnea, OSA, a condition characterized by repeated pauses in breathing during sleep. Losing weight through a balanced diet and regular exercise can help reduce snoring severity by decreasing fatty tissue around the airways and improving airflow. Diet plays a significant role in snoring prevention and reduction. A diet rich in fruits, vegetables, whole grains, and lean proteins can promote overall health and reduce snoring. Certain foods, such as dairy and spicy foods, can contribute to mucus production and nasal congestion, exacerbating snoring in some individuals. According to a study in the American Journal of Respiratory and Critical Care Medicine, dietary patterns that include high intake of saturated fats and carbohydrates are associated with increased prevalence of snoring and OSA. Therefore, adopting a balanced diet that supports weight management and minimizes inflammatory responses can help alleviate snoring. Hydration is another essential factor in reducing snoring. Dehydration can lead to thickened mucus in the nasal passages and throat, obstructing airflow and contributing to snoring. The National Sleep Foundation recommends drinking plenty of water throughout the day to keep nasal passages moist and reduce the likelihood of snoring. Proper hydration also supports overall respiratory health and can aid in maintaining normal mucous membrane function. Sleep position adjustment. Sleep position plays a significant role in snoring, as certain positions can exacerbate airway obstruction and lead to louder snoring. The most common position associated with snoring is sleeping on one's back, which can cause the tongue and soft tissues at the back of the throat to collapse into the airway, narrowing it and causing vibrations that result in snoring. Research published in the Journal of Clinical Sleep Medicine highlights that positional therapy, such as avoiding sleeping on the back, supine position, can significantly reduce snoring frequency and severity in individuals with positional snoring. Switching to side sleeping positions, mainly sleeping on the left side, is often recommended to alleviate snoring. Side sleeping helps keep the airway open and prevents the tongue from falling back, reducing the likelihood of snoring. A study published in the American Journal of Respiratory and Critical Care Medicine found that lateral sleeping positions are associated with decreased snoring intensity compared to supine sleeping. This adjustment can be a simple yet effective natural remedy for those struggling with snoring. Elevating the head of the bed or using extra pillows to elevate the upper body can also help reduce snoring. By keeping the head and neck in a slightly elevated position, gravity helps prevent the collapse of throat tissues and promotes easier breathing during sleep. Research in the Journal of Clinical Sleep Medicine suggests that elevating the head by approximately 30 to 45 degrees can decrease snoring intensity and frequency by facilitating better airflow and reducing obstruction in the upper airway. Nasal and sinus health. Nasal and sinus health plays a significant role in the occurrence and severity of snoring. Many cases of snoring are linked to nasal congestion or obstruction, which can restrict airflow during sleep and lead to the vibration of tissues in the throat, causing the characteristic snoring sound. Research published in the journal Sleep Medicine Reviews highlights that nasal congestion is a common factor contributing to snoring, especially in individuals who primarily breathe through their noses during sleep. Effective management of nasal congestion can often reduce snoring significantly. Natural remedies such as saline nasal rinses are widely recommended for clearing nasal passages. Saline rinses help moisturize nasal passages, reduce inflammation, and flush out irritants and allergens that may contribute to congestion. According to a study in the American Journal of Rhinology and Allergy, regular saline nasal irrigation has been shown to improve nasal airflow and reduce snoring intensity in patients with chronic nasal congestion. Steam inhalation is another beneficial remedy for nasal congestion and snoring. Inhaling steam helps to moisten and open nasal passages, providing immediate relief from congestion. Adding essential oils such as eucalyptus or peppermint to the steam can enhance its decongestant properties. Research published in Evidence-Based Complementary and Alternative Medicine suggests that steam inhalation with essential oils can improve nasal airflow and reduce snoring frequency by reducing nasal inflammation and promoting clearer breathing. Throat exercises. Throat exercises are a non-invasive and natural approach to reducing snoring by strengthening the muscles in the throat and mouth. These exercises target the tissues that can collapse and obstruct the airway during sleep, leading to the vibrations that cause snoring. One effective exercise involves pressing the tongue tip against the roof of the mouth and sliding it backward. This action helps tone the muscles in the throat and prevent them from collapsing, thereby reducing snoring. Research published in the American Journal of Respiratory and Critical Care Medicine highlights that targeted exercises can improve muscle tone and decrease the severity of snoring by enhancing airway stability. Another beneficial throat exercise for snoring involves repeating vowel sounds loudly and clearly. This exercise helps to tighten the muscles around the throat and palate, improving their ability to keep the airway open during sleep. A study conducted by the Journal of Clinical Sleep Medicine found that participants who regularly practiced these vocal exercises experienced significant reductions in snoring frequency and intensity compared to those who did not engage in such exercises. Exercises that involve singing or playing wind instruments can also strengthen the muscles in the throat and improve snoring. These activities require controlled breathing techniques that engage the throat muscles, promoting muscle tone and reducing the likelihood of airway collapse during sleep. According to a study published in the European Respiratory Journal, individuals who regularly participated in singing exercises showed improvements in snoring severity and sleep quality compared to non-singers. In conclusion, natural remedies might help you find relief if you can't stop snoring. Incorporating lifestyle changes such as sleeping on your side, maintaining a healthy weight, and avoiding alcohol before bedtime can significantly reduce snoring. Additionally, using nasal strips or trying throat exercises to strengthen muscles may improve airflow and reduce the vibrations that cause snoring. While severe cases may require medical intervention, embracing these natural approaches can often be an effective first step towards quieter, more restful nights. That's all we have for you today regarding snoring remedies. Remember, a good night's sleep is so essential. Hopefully, these tips can help you achieve that. If you found this video helpful, don't forget to subscribe and give it a thumbs up. Let me know in the comments below what sleep struggles you're facing. Until next time, stay happy and healthy.